You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he said nobody should be wearing a loose-fitting denture. And with us, we have an expert on this topic. He is Montana's dental implant dentist, Dr. Matt Larsen. Dr. Larsen, welcome to the program.
Thanks, Randy. Glad to be here.
Now, you brought some photos, so we'll get into that in a moment. But for people that don't know your practice, like who's the typical dental implant patient?
We have a couple of different categories of patients. First, we've got patients that just have a couple missing teeth, and they just want to replace those teeth.
Okay.
Those we just put dental implants in. We replace the teeth. We give them teeth back. We let them chew. We fill in the spaces. The other group is people that maybe have trouble with teeth, and they've got loose teeth. They got bad breath. They've got bleeding gums, and they've got teeth that just can't be saved. And in those patients, sometimes we have to take the teeth out and replace them with dental implants. And that's something that we can do. They can either have a denture that snaps in and out, that's fixed in there, or we can actually make them teeth that don't come in and out, that look very natural and feel very natural, and allow them to chew and eat whatever they'd like. The other group of patients are patients who are already wearing a denture. And that group of patients are really hard to reach because they don't come to the dentist. And those patients, we can stabilize their denture with implants under the denture so it snaps in and out.
Okay.
Or we can give them back their teeth, give them back a natural smile and the ability to eat and talk and laugh normally.
Now we should mention, I guess at your office, as you explained, that how it's typically done with dental implants is you go to one doctor that does the surgery, and then you go to another dentist that puts the teeth on top, and somewhere else for the imaging. And I guess you have this all in one place system.
Yeah, Randy, I have training in both the surgical and the restorative part. So we do the whole procedure in our office. We can take people from no teeth. We've got a lab. We can build the teeth in the office.
Oh, right there. You have a lab right there.
We can build the teeth. We can take the imaging. We can place the implants. And we literally put teeth on those implants that day. People could come in, teeth come out, implants in, teeth in, and they can go home and eat and smile.
In Montana, are there a lot of people wearing a denture?
We have a lot of people wearing a denture. And you wouldn't know it because they never show their teeth. But as a dentist, we can see them walking around because they've got sort of that grumpy look to them, and their lips kind of cave in a little bit. And you can always tell that they sort of pucker up and their face kind of collapses. And we've got a lot of those people, Randy.
Would you say thousands of people?
Yeah.
Really?
There's a small suburb of Billings called Laurel, and we could fill the entire town of Laurel with the denture wearing patients in Billings. And all surrounding Billings, we've got thousands and thousands of patients that are wearing dentures, but they don't ever go to the dentist.
Well, I mean, if dental implants are so good, why aren't they all doing it, coming in to do this? What's your take?
Well, Randy, I think there's a couple different reasons. I think the first reason is people that are wearing dentures, they don't go to the dentist. That's one of the things that got them into dentures is problems with their teeth. They had pain, they had bleeding gums, they had loose teeth, they couldn't eat, and they'd go into the dentist, and every time they went into the dentist, they'd come away with pain. They'd have to have a tooth taken out or they'd have a filling done, and they had a lot of expensive treatment done. And these people over the years, they kind of got traumatized by all this dentistry that they had done. So when they finally get their teeth taken out and they've got dentures, the last thing they want to do is go to the dentist.
Is that right? Do you hear that? Like, no offense, doctor, but...
All the time, every day. That's my life, is people telling me it, nothing personal, but I hate the dentist.
Do you have a good comeback after all these years?
I always thank them.
Okay.
And I tell them I've got broad shoulders, so give me a chance. But these patients that have dentures, they're at the point in their life where the last thing they want to do is see the dentist. And so it's really hard to reach them and to be able to show them what we can do now.
So they don't know their options?
No, dentistry's changed so much, even in just the last 5 years. And there's so many more techniques that we can do, and there's so many more things available to us to be able to improve their dentures, to stabilize them, to fix them, and even to take them back to having natural teeth.
But isn't it true, if you've been wearing a denture like 10 years or 15 years, you don't have enough bone to do this?
No, that's not true. We used to look at it that way. Randy, let me tell you, I was that guy.
What do you mean?
If you went back 15 years in my practice, when I was first starting out, with the imaging that I had, with the training that I had a lot of patients that I said that exact thing to. I saw them in my office.
Like you don't have enough bone to do
right,
this.
They'd been wearing dentures for years, and they came in and said, you know what, I'm just so tired of my dentures not fitting. I'm tired of every time I bite down, they tip to one side, they dig in, I get a sore spot. And you know what I told them? I took a couple x-rays with the x-rays that I had at the time, and I said, well, you know, unfortunately, there's not much we can do because you don't have enough bone. Well, Randy, since I've been trained on doing dental implants, I went and have done residencies with implants, and I've learned how to read three-dimensional imaging, and I've learned so much more. I look back at those patients and I think I was so
it'd be nice to get them back in if they stumble onto the show watching it.
Yeah, if they were watching the show, come back in, come see me, because there's so much more we can do now. And it's very rare now that I ever see a patient.
So you don't have to turn anybody away.
No, everybody's got enough bone. It's a matter of us being able to find it or augment it and be able to put implants in. I feel like everybody is a candidate for this.
So how old can you be to get this done?
Age isn't really a factor anymore. We have patients that we do this procedure on that are well into their 80s and 90s. In fact, we had a patient come in that had a loose-fitting denture. She was 99 years old. We put 2 little implants in, and we snapped her denture onto those little implants. And she was as happy as can be because her denture didn't flop in and out. And when she was talking to her grandkids or when she was at her family reunion, she didn't have to worry about them popping up and down. And that was her big concern. They started moving around and clacking against her upper teeth. And she was so happy. You know, she only lived to be 102. So she only lived about 3 years after that. But she was so happy to have those teeth stabilized and not have to worry about them.
So 99 years old. You had to be a little nervous on a 99-year-old.
Oh, yeah.
You were?
Absolutely.
Okay. But so 80, 70, that's like not an issue at all.
Oh,
but a
yeah.
lot of these people think they're too old to do it?
No. 80s, I've got a patient right now, 82 years old, and we're doing a full arch of teeth on implants. We're not doing anything removable. They're fixed in. She smiles with them. She chews with them. Age isn't an issue anymore. If you're 80 years old, you're probably not working.
Okay.
Your life revolves around food. It revolves around family events. And what do you do at every family event? Every family event, you eat. You go to a picnic, you go to a reunion, you go out to dinner. We eat. That's our social mode anymore. And so if you're 80 years old, you want to be able to eat. You want to be able to eat the foods that everybody else is eating. You don't want to have to pick through and pick the mashed potatoes and that's all you're eating.
Is that what they tell you?
Yeah, they can't eat tough, fibrous foods. And the more we learn about health and being healthy, we learn that the foods that we need to eat to give our bodies the best nutrients and make us the healthiest are the foods that are closest to their natural state.
Yeah.
But if you think of foods in their natural state, you think of raw broccoli. You know, they call it a superfood. You think of nuts, things that are...
So they can't eat those things if you're wearing a denture.
And if you don't have anything stabilizing it in, when you bite down, you think about it, all those teeth do is they float around in your mouth. So they bite on one side, the other side comes loose. And they never have stability to them. They could maybe eat them in the privacy of their own home where they can just mash them up between their dentures. But people that go to dentures, they don't chew anymore. That you can't even call it chewing. They become mashers. And that's
so it's
what
kind
I
of
tell
like rubbing
people.
it together?
Yeah,
kind of
absolutely.
Interesting.
They aren't chewing anymore. And I tell people that. I've had patients that are going to dentures and I tell them beforehand, I say, now you got to understand, you're done chewing. You're going to become a masher now. And the way that you use dentures is nothing like you use teeth. You'll put food in there and you'll mash it around, but you're always going to have to concentrate on balancing your teeth and balancing where that food is and keeping it from getting underneath your dentures. So it's a whole different life. And people that have had dentures for a long time, they adapt to this. They go to their family reunion or they go to a restaurant and they're looking at the menu, and Randy, they're looking for things that they can eat. And you know what, most of them, they don't even realize they do this anymore. They say they've adapted to their dentures. Well, that's what they've done. Is they look at that menu and they say, oh, I'm not going to get the salad. I'm not going to get the broccoli. I'm going to leave the corn on the cob alone. And all those things that are so good for us and that give us so much nutrition, they don't eat it.
So implants solves that problem.
Oh.
I guess the challenge is just getting the word out, letting people know their options. Now you brought photos. What are we looking at here?
Well, I brought a couple of cases of people that
Because you say it changes their lives.
It changes their lives so much. Let me show you an example. We just talked about this one.
All right.
This first one, this is
oh my goodness.
This is the lady I'm talking to you about. We haven't even completed her case.
That's got to be unusual.
No, Randy, we see that all the time, day in and day out. You don't see it. You think it's unusual because you don't see these people. This lady right here.
Like they don't smile?
Yeah, if you met her on the street, she wouldn't smile. Even if you had told her a really good joke, she'd either cover her mouth or she'd pucker her lips up.
Wow.
And you would never see these teeth. So you'd have no idea that this is what her mouth looked like on the inside. I get surprised all the time when I have people that I know from church or working at the school or different things that they'll come in and I'll think they've got great teeth. And they come in and I look in their mouth and I see what they've been hiding. Back to this woman, these teeth, we couldn't save them.
Okay.
We did some imaging. She's got some infection in her mouth. She's got missing teeth. She's got loose teeth. There wasn't enough there.
So is that painful?
That is painful. When the teeth get loose, when they're moving around, they're not meant to do that.
Okay.
Teeth are meant to be solid. You're meant to be able to chew against them and have them not move.
So what were her options and what did you do?
When she came to us, she thought she was going to need to go to a denture.
Okay.
And she hated the thought of going to a denture. But we told her, we don't recommend a denture. We recommend that you get your teeth back. We recommend that you get your smile back.
Who could say no to that?
Yeah, and when she found that out, she was so excited that she didn't have to have a denture. We set her up for an appointment and we took the teeth out and we put teeth in that same day.
So right there, that's what I'm looking at.
That's what you're looking at. That's temporary teeth that she's wearing while everything's healing. And that's the smile.
So those don't come in and out?
No, those teeth stay in. She couldn't remove them if she wanted to. They're solid. She eats against them. She chews against them. They're permanent teeth.
Is this one of those things where people wish they would have done it years ago?
Yeah. She's had these teeth like this for a long time. That's why she thought there were no options. That's why she didn't come in. She wishes that she'd have done this 20 years earlier. Because think of all the time she's lost, that she could have had this smile, that she could have been talking and laughing and eating whatever she wants. The reason I brought this picture and I show this picture of the temporary is because this patient came to us because she had pain and she couldn't chew very well. It wasn't a cosmetic reason that she came to us. But if you look at that bottom picture closely, you can see that the midline of her two front teeth is off slightly. Well, guess what her big concern is when we started moving forward with this treatment? Now she loves her smile. She's concerned with how she looks. We've increased the shade of the teeth a shade wider than we originally intended. We've corrected the midline. We've done so many little things because once she got these teeth in, even though they're temporary teeth, she's found she smiles so much more. She's looking at herself in the mirror at home. She's looking at herself in the car. The first thing she wants when we see her in the office and we change that temporary, she wants to see. And she's so concerned now about the aesthetics of it because the pain's gone. She's chewing now. She's already forgetting what it was like to not have teeth. And now she's so excited about how she looks.
So no more dentures?
No more dentures. She's in her 80s and she comes in and she's happy and she's smiling. She drives 3 hours to get to my office.
Is that right?
Yeah, 3 hours to come into our office. And so we always try to minimize the amount of time that she's come in, but to get this aesthetics just the way she wants, she drives in. She brought us old pictures of when she was younger and told us this is how I want my teeth to look. And we communicate those to the lab. And we've made more alterations to her temporary than anyone else. 80 years old. And that's what she appreciates the most, is the look, is the smile, is what the confidence that it gives her. Here's another patient.
Okay.
Take a look at this picture. Look at the teeth. Look at her teeth on there. She was a patient of mine for a long time, and she would never smile. I don't know if I ever saw her teeth. I'd have to pry her open just to get in and do an exam on her teeth. because she hated the way that they looked. She hated the smile. And so she would come in and she would get her teeth cleaned, and we would try to maintain them as best that we could. And finally we got to the point where she was having pain, we were losing teeth. She didn't have any other options. I gave her all her options. I always sit a patient down and I say, you can do a denture. You're gonna hate it. This is how dentures work. I give them an option that they could do a denture with a couple implants under it to try to stabilize it, to try and make it a little more bearable.
Okay.
And I gave her the option. I said, we can replace your teeth with new teeth with dental implants that don't come in and out, that you can smile and chew with. But I was also so excited because I knew what she was in for.
Okay.
I knew what we could do for her. I knew how we could make her look. And she is one that we took the teeth out. We put in the provisional, and she went home and started eating. And I always remember having a conversation with her, and she said, Dr. Larsen, I have to tell you that I was in my backyard the other day, and I took an apple and I looked at it, and I knew you told me I could do it, but I was nervous about doing it. And she said, I took a bite of it. And she said, I started crying because
It's a good story.
I can't tell you how long it's been since I bit an apple. She hadn't. You look at her
Those
teeth
are good
there.
looking teeth, by the way. I mean, she looks like a younger woman now.
She's a totally different person. When she comes in to see us now, she smiles all the time. It's like she's going out of her way to try and show her teeth off. Look at the after picture. Look at those teeth.
They look real.
You couldn't tell that those weren't her real teeth that she was born with.
So you're involved in the design.
Oh yeah, we look at the way they follow her lip. The central incisors are slightly longer. The
front two teeth.
Yeah, the front two teeth are a little longer. The step to them, the contours of them, they're very natural. You couldn't tell that was that was not her natural smile.
And she can eat whatever she wants.
Whatever she wants.
So those
She can
don't come
eat-
in and out.
Yeah, she can eat things that she has not been able to eat since she was 20 years old. She's always had problems with her teeth. And now anything she picks up, she can eat.
Now, you brought up something at the very beginning. Even you thought she wasn't going to go for it. You know, in the movies, we talked about this in the green room, that people with bad teeth are judged. Like in the movies, you want to make somebody look poor, you give them bad teeth. You want to make somebody like a villain, you give them gray, dark teeth. If you want to make somebody look not so smart, you remove their front teeth.
You're exactly right.
Yeah.
You look at the movie Dumb and Dumber. What did they do? They chopped off Jim Carrey's front tooth, and it totally changed the person that he looked like. And you know, we don't judge people. We try not to judge them, but all of us naturally, when we see that, we've been programmed to see that. And when you think about seeing somebody that smiles and they've got a beautiful smile versus when you interact with somebody and they smile and they've got a couple missing teeth, how does it make you feel? What do you think when you see that? I know when I'm doing interviews or potential candidates, that's one of the first things I see.
Like
is
for
someone
jobs.
smile. Oh yeah, for a job, when you're interacting with people on the street, that's always one of the number one things when people are talking about what attracts them the most to somebody else. It's the smile.
I mean, it's always in the top three, right? Smile, eyes, personality. So the smile, well, of course you're a dentist, so you think it's important, right? The teeth, probably the most important thing.
Yes, it is. It's so important because you say that, but, and I am a dentist, but I look at the teeth and I want them to be able to chew. And if you think about your mouth, what all does your mouth do for you? When you chew your food, that's how you get nutrition. That's how you stay alive, is when you chew your teeth. It's also where your taste buds are. So if you're going to cover all that up with plastic, or if you've got infection in there, it kills the taste. You can't taste your food because all you're tasting is that infection and all that bacteria that's in your mouth. And with a denture, it covers up a lot of your mouth so you can't taste it. You can't feel hot and cold. There's so much that you miss out on. And so we talk about the smile being one of the top three always. Well, yeah, it is, but this is so much more. You know, it's so much more than just the smile. Now, the smile is fun. And we have a lot of fun with that with our patients because we get to make them look perfect. And when we take patients like this, they have no idea what we can do for them. They have no idea the potential and the technology that we have.
So on these consults, on a consult, you hear their hard luck story, how bad their teeth. Do you get excited? Like in your mind, you're going, this is going to be good.
I always get excited. This is my favorite thing to do. Ever since I started doing these these cases where we're taking people that haven't had teeth and putting them back into teeth, to have them come back and get emotional in my office and say, you've changed my life. You've literally changed my life. And not just my teeth and not just eating, but my confidence and the way that I interact with my friends. I go out more. I do more things. Yeah, it totally changes people.
It's like these guys that get their hair back. They're hiking and running. It sounds like an exaggeration, but I guess, when you feel good about yourself, you're more engaged, probably.
Exactly. That's what we need to show, is these people out running and laughing, because it totally changes them.
Now, we should mention, you work as a team oftentimes with Dr. Pearson, Dr. Chase Pearson.
Yeah, Dr. Pearson's in the office as well. And he and I have similar training. It's been really fun because we've gone to a lot of the same residencies and courses to learn how to do this. And it's also really nice because sometimes he and I can sit down together and look at a case like these.
Okay.
And we can look at, this is what I'm wanting to do. This is what I think would look good. And he can look at me and say, yeah, I think that would look good, but what about this? And so to be able to have two minds and two eyes looking at it and going over each of these cases, it's almost like you've got a second opinion right there in the office.
So Dr. Pearson does sedation, I guess IV sedation, you have oral sedation, you even have that gas. Are people using that?
Yeah, people use that all the time. And we like for people to use that, because no matter how good we are or how good the procedure goes, it's not necessarily something you want to remember having a surgical procedure.
Yeah.
So it's always nice to have a little something to just help them relax. It helps the whole procedure go smoother, and it's better for them, it's better for us. And if they're really anxious and they really need a lot of sedation, Dr. Pearson does the IV sedation so they can miss the whole appointment.
Is that right? So it's almost like, some people wake up and they don't remember it being done?
Yeah, I would say most of them don't remember what we did. We'll ask them at our follow-up appointment, we'll say, well, what do you remember? And they're like, well, I remember I was on my way to your office, and then I remembered I was at home sitting in my chair. And it's nice, because that's not something you want to remember. But then what's fun is they're like, and I have teeth. And I was looking in the mirror and I have teeth. And then I was eating my dinner, and it was a whole new experience.
Now, we should mention pain for a moment, because you've told me that, look, if everything works out, like, it's very little pain. Like, during the procedure, they don't feel anything.
Very little pain.
So pain is not like a big thing that they're complaining about.
No, in fact, when we take patients and we put them into a denture, we have way more pain involved in that than when we do the implants and put the bridge on it. I usually talk to people that night. A lot of patients, they'll maybe take an ibuprofen.
Okay.
And they never even use the pain medications that we give to them. And so I'm always amazed at how little pain and how easily people adapt to it. When we do a denture, we're seeing people a couple times a week for probably a month, trying to get everything adjusted in and get rid of the sore spots and the pain and all the problems they're having. And with these, I usually see them to dial in the bite, maybe make a few little cosmetic changes to it, and they'll go for months in these temporaries without having any problem.
Good. We have time for one more photo. Well, and we only have a few more minutes left.
All right, let's look at this one here.
Okay. Oh my goodness.
This is another one that coming to see me for years. And I have to confess again on this patient. This is a patient that I told her we could save her teeth. Okay. I told her that if she would brush and floss and take care of them at home and do everything I said, we would save her teeth. And I was wrong. And I saw her for a lot of years. And I'm very close with her and her husband, and they've been patients of mine as long as I've been practicing. And we got to a point where I had put so many fillings in her mouth and done so many crowns and patched and repaired. And we got to the point that we just couldn't repair it anymore. We couldn't save the teeth.
They have a bacterial infection?
They have gum disease. They have decay, they have periodontal disease.
Okay.
And there's nothing we can do to save the teeth.
So she was headed for a denture. Like, that was pretty much her options.
Yeah, she was gonna lose her teeth. And I'd worked with her for so long, and there's no way I was gonna put her into a denture.
Okay.
She'd be miserable, and I knew she'd be miserable. And so her and I, we sat down and we talked, and I said, I know that we've spent a lot of years with you being in pain, with you breaking teeth, with you seeing me all the time. And she really felt like she saw me all the time, and she probably did. And I said, we can change all that. And I think it's time that we do something permanent. So in one afternoon, we removed those teeth and we put in a new set of teeth. She's never been the same since. It changed her life. Look at the after picture. Look at those
nice.
teeth. Look at the difference. Look at the contour of those teeth. So when we finished this case and she looked in the mirror for the first time, she couldn't believe the smile that she had. She couldn't believe that she had teeth that she could be proud to show. Not only did she get this smile back, but she'd been dealing with sleep apnea for a long time. We'd made her an appliance that she would sleep with so that she could breathe properly while she slept.
Okay.
She couldn't wear that anymore until we gave her these new teeth.
Okay.
We gave her the new teeth, we put the appliance in, she could sleep, she could breathe at night. And a funny thing, she came to me and she said, I gotta tell you something, and this might sound weird, but I said, go ahead. And she says, you've probably saved my marriage. And I said, that does sound weird. Why would you say that? Well, because now that I don't snore, I can sleep in the same room with my husband again. I've been
Nice.
sleeping in a different room, and now we're sleeping in the same room again. And I said, that does sound weird, but thank you for sharing that. Isn't that
Well,
amazing?
good.
How it changes people's lives. It's not just a smile. It's not just chewing and eating.
So we're out of time. Somebody watching this, maybe they have a loose fitting denture, right? Or maybe it's the person that has the bleeding gums. Their teeth are really bad. They know one thing, they don't want a denture. What do you say to them? What's your final message? But they're still scared for whatever reason.
My final message, come see me.
Okay.
We do complimentary consults. That's why we do them. We want to make it easy for you to come in the door. There's no judgment. You're not the worst teeth we've ever seen, I promise.
They say that?
Everybody says
Like,
that.
Doc, this is the worst you've ever seen?
Everybody says that. It's not.
Why do they say that?
Because they're so embarrassed and they've never seen anyone else with bad teeth. We see it all the time.
Because those people don't smile.
Yeah, they don't smile. They're
Okay.
not going to show their teeth. Come see me. That's my takeaway message is come see me and let's just talk.
About your options.
Yeah, let's talk about your options and let's see what's possible.
Now, we should mention that Medicare, Medicaid doesn't cover this. Even with great dental insurance, it doesn't cover the whole thing, just a very small portion.
That's correct. But we offer financing. We have ways that we can make it possible for people to get this treatment.
Do they finance it all the time?
Most people do.
Okay.
Most people finance it. The biggest thing, don't wait too long. Come talk to us. Don't be like some of these patients that I've showed you that have waited 20 years.
They've
and
hated their
lost-
smile for
that
20
have
years.
lost that much of their life.
I want to thank you for coming on the show.
Thank you. It's a pleasure to be here.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.